Okay, hi, I'm Dr. Warren Glack. I'm the medical director of the emergency department here at the Sierra Vista Regional Health Center. I've been here since 1995, basically serving in this capacity, and I've seen this department grow from 800 to 1,000 visits a month up to 2,500 to 3,000 visits a month. The best part of my job by far is dealing with the patients and seeing patients and dealing with the staff at the hospital, the nurses, the respiratory therapists, the lab, all those sorts of things are still what I like to do, by far the best. And the best part, I think, is that because we are somewhat isolated, you'll find that what you do here really does make a difference because the area of the population are sometimes entirely in our hands to do the right thing for them. What I like is we're still a somewhat old-fashioned group, which is to say we're not part of a national group whatsoever. We're a small group with all the good and bad things that encompasses, but somebody who joins this group would then become a full shareholder partner in the group at the end of a year, assuming we all still like each other at the end of a year. Those kinds of opportunities are going to be few and far between as national groups are starting to scoop up contracts around the country. Technically, we are a level 3 from a trauma standpoint. It's somewhat moot because we're the only ER in this region, which is to say that we see some very acute cases and then arrange some pretty fast and slow transports when we need to. But technically, we are a level 3 trauma. We have a helipad built right into the roof just outside with an elevator that goes right up to it. We have very good working relationships with hospitals in Tucson, which are only about 30 air miles away. Frequently for those patients that require that, we arrange quick transports. Nursing staff here has a real interest in doing a very good job and in trying to impress the community with the kind of quality that we can offer here. What we're looking for is somebody who has the same sort of notion of being a member of a small group, making that sort of long-term commitment to be with the group, to be with the hospital, to be with the community, and to make improvements as we go. There are things that because we are the only hospital and the only ER group, if there are things that you think the city needs to do to make this a better place to be or a safer place, all kinds of things that we could do, the whole area is motivated to help us do that sort of stuff. This area is located close enough to Tucson that many of us actually live in Tucson and commute to here. The group built a house that we have here in Sierra Vista, so nobody stays in a motel or anything. And the usual thing is we come out for a shift or two and just stay overnight in our own place, which is very comfortable. It's actually a very nice house, and then head home after your second shift, so that any kind of commute is really kept to a minimum.